Good afternoon, everyone. Welcome to our session today on Provider Connect Australia. My name is Priyanka, and I'm the Allied Health Integrations Program Officer here at CESPIN. Thank you for joining our recorded session today. While we might not be interacting in real time, the insights and the information we're about to share are as important. At the end of the presentation, you'll find our contact details. If you have any questions regarding PCA and the registration process, you can get in touch with us. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize their continuing connection with land, water, and community, and pay my respects to elders past, present, and emerging. I would also like to extend that respect to any Aboriginal colleagues joining us today. So in today's webinar, we'll focus on recognizing the challenges faced by RACFs and allied health professionals, gaining insights into PCA's role as a one-stop solution. We'll also understand the purpose and the benefits of using PCA and how it works, along with some practical tips on registering for this platform. For those who are new to CESPIN webinars, just a little bit of background information about CESPIN. Central and Eastern Sydney Primary Health Network caters to a population of 1.5 million people spread across a vast 587 square kilometre of area, stretching from Bondi to Sutherland in south and reaching as far west as Strathfield. This includes the population of Lord Howe Islands. Projections suggest that by 2031, our population will exceed 1.9 million, with a notable increase in the individuals over the age of 65 years. We support a whole range of healthcare providers that includes general practice, specialists, and pharmacies. So before we delve into PCA, let's acknowledge the challenges in aged care and allied health. The aged care workforce census 2020 reported a 29% staff turnover, far exceeding 7.5% average in other sectors. Additionally, many allied health practitioners, often sole traders, grapple with limited time and resources. So understanding these issues sets the stage for how PCA aims to streamline the process, offering a practical one-stop shop solution for a more efficient healthcare landscape. The reason why PCA was born was because of the issues faced by the healthcare organizations when it came to updating information and publishing it to various business partners. Even though this webinar is targeted at RACFs and allied health, the system is currently being used by GPs and all other healthcare providers. So the problem is the healthcare organizations heavily rely on various business partners to support service delivery, and registering and updating information with the business partners can become a significant administrative burden for many organizations. These business partners may include health directories, booking and review services, secure messaging providers, and public health services. One of the primary issues lies in the registration process. Business partners typically require organizations to register the details of the service they offer and the practitioners providing them, and this process can be time-consuming and complex. Another hurdle that's faced by the organizations is practitioner onboarding. When a new practitioner joins a healthcare organization, a lot of forms with similar information need to be completed to update these partners. And this can not only be time consuming, but also increases the risk of transcription errors. And furthermore, changes in practitioners pose an ongoing challenge, whether it's a practitioner joining or leaving the organization. Notifying the partners about these changes is crucial. and failure to do so can disrupt the service delivery and can lead to communication breakdowns. So the impact can be missed updates, leading to incomplete and out-of-date information to the business partners, errors of form and in transcription, barriers to uptake the new programs, and overall systemic lack of access to the up-to-date service. So the solution is a provider Connect Australia PCA. It is a newly introduced free service provided by the Australian Digital Health Agency. It connects healthcare providers with their business partners, thereby streamlining the registration and ongoing updates. So the PCA serves as a comprehensive solution for updating the details on a single platform, which are then distributed to all the business partners. So it eliminates the requirement to fill out 10 to 20 forms separately. So the purpose of PCA is to facilitate the accurate updating of business information. It automates the distribution of the information to the business partners, and these business partners can include the nominated hospitals, pathology and radiology providers, public service directories, secure messaging providers, and many more. And PCA offers several benefits, such as improving the communication and sharing information between healthcare providers. It will reduce the transcribing errors and remove the hassle of filling out multiple forms, thereby significantly reducing the administrative burden on the organizations. So this is a visual representation of how the PCA system works. The healthcare provider organizations are on the left. These can be termed as the publishers. These include primary care providers, allied health specialists, hospitals, and these are the organizations that are responsible for keeping this information up to date and using this tool to disseminate the information to the business partners. Verification services ensure that the tool is secure. You can be required to authenticate it by using your HPIO and HPIIs, and also the collaboration with institutes like APRA and Service Australia contributes to the overall security of the system. On the right-hand side, we have the business partners who are the subscribers of PCA seeking regular updates. So the current business partners on PCA include the Health Service Directory. It is Health Direct, Primary Health Networks, secure messaging providers, and public health services such as eHealth New South Wales. And many more will be added to the system in coming months. So now how to register for PCA. So you will need a PRODA account to start with. And the agency has a comprehensive guide on initiating the process. And I have included the link to the pre-registration checklist. Should you require any assistance or support, please feel free to reach out to us. And if you intend to share your identifiers with organizations such as a Health Direct or Medicare, you will need to make agency as the contracted service provider on HBOS. During the registration process, you will need to sign a participation agreement with the agency, and the individual responsible for signing the agreement will depend on the legal structure of your organization. So once you have signed the participation agreement, you can log into your PCA portal and start with registering your healthcare organization. And the second step involves you can import your healthcare identifiers or add any subsidiary organizations. You can add the location of the service, what services you are providing, and all the practitioners within your organization, and then choose to publish it to the business partners. So the information that you can publish is you can publish when there's a new practitioner joining or a practitioner leaving your organization, if there's a change in your organization contact details, if the location has changed, or if there are any services, any new services that you're offering, or any discontinued services. Any change in the operating hours can be updated, and you can choose to publish these details to partners or consumers. Like on Health Direct, you can choose it to publish to either just your business partners, or you can publish it to go live to all the consumers. So this brings us to the end of the session. If any questions or comments arise, please feel to reach out to myself or Carol through the contact details on the screen. We'll also include the agency contact should you wish to begin the registration process for PCA. And if you're an interested allied health provider, you can reach out to me directly. And for aged care, please reach out to Carol. That's all from me. Thank you.